Hey guys, Dr. Eddy Dona, specialist plastic surgeon. I want to talk about the most frequently asked question when it comes to breast surgery. Now, whether I'm making someone bigger or smaller, the most frequent question is, what cup size am I going to be? Unfortunately, it's the only question that you can ask that I can't, or indeed no surgeon can, give you a proper definitive answer. So why is that? Well, what's a breast size? When you get breast size, it's a number and a letter. You're assigned a number and a letter. Now, how is a breast sizing done? Well, breast sizing, there are two measurements taken on the patient, and they're both circumferential measurements. One's at the underbust and one's at the level of the breast. So with regards to the underbust measurement, that's taken in inches, and in Australia, if you're 28 inches, that refers to a size 6, 30 inches is a size 8, 32 is a size 10, etc. And then with regards to the breast measurements, so using those two measurements, the difference in those two measurements is how they determine the cup. So if there's no difference between those measurements, so your chest is basically completely flat, you are a double A. If it's a 1-inch difference, it's an A. A 2-inch difference, B. 3-inch is a C. 4-inch is a D. 5-inch is a double D, etc. So you measured up, you're assigned a letter, you're assigned a number and a letter. Now the most important thing of all that is the cup size, the letter, does not correlate to a volume. So in other words, a 14B is a much bigger breast volume than say a 8B. And likewise a 14B is the same volume as say a 10D. So cups do not mean volume or overall breast size. So what does all that mean? Well, for argument's sake, we're doing a breast augmentation, we're having a discussion, we determine that this implant, for argument's sake, is what we're going to be using. I cannot say to that patient, I'm using this implant size, therefore you're going to end up with this cup size because this volume does not correlate to a cup. So what does all that mean then? Well, when you are going in to have a consultation, come in and just say what look you're trying to achieve. Then we'll work together, look at all your different issues that we need to determine, work out what implant's going to technically work on you, complement your existing breast tissue, and give you the desired breast look. And that will then determine your cup size, which you'll find out 6 weeks later once all the swelling has settled down and you've been formally fitted. Anyway, if you'd like to know more about breast implant surgery, please feel free to give our office a call.